Hi, everybody. If our paths have not yet crossed, I'm Jessica Shore, and I'm the Director of Clinical Affairs and Advocacy here, and it is a privilege to be moderating this program, especially during CurePSP's Month of Awareness. Welcome to CurePSP's Community Conversations webinar on the topic of legislative advocacy for PSP, CBD, and MSA. I have invited two very special people to provide us with their personal and professional guidance on this very important topic for us. But before we get started, I need to share just a couple of housekeeping items quickly. This program will be about an hour long, including the conversation with our guest speakers and time at the end to be able to take questions from viewers. If you are watching this live and you would like to ask us a question, you're welcome to type your question in the comment section on the platform that you are using to watch this. We also have the questions that we received from registration. Please know that this webinar and the responses to the questions are not ever meant to be medical advice. We recommend not sharing personal medical information in the chat, and we encourage you to talk to your healthcare team if you have medical concerns or questions. You can also use the comment box to say hi to us and maybe share where you're tuning in from today, if you would like. This webinar is recorded. If you had registered for today's program, you will receive an email with the recording for you to view again later or to share with friends and family. It will also be archived on CurePSP's YouTube channel and on Facebook for anyone to view later. We encourage you to share it with others, as well as many people can't watch these live, but especially this topic, it's just such an interesting and new one for us. And so we'd really love to share it around. At this time, I'd like to introduce our special guests for today. I'm gonna wait for them to come up on the screen. We have, we have Julie Balasalle and Sanjay. I have this from the last webinar that we did. I didn't change it on here. And we have Salin. I have my notes in front of me, so everyone. I work with Salin's son, Sanjay, really closely as well. Geevarghese. I'm going to let them tell you more about who they are, but I'll say that they both have extensive professional experience in public policy. Both of their mothers were diagnosed with corticobasal degeneration, one of the diagnoses that we work with here at CurePSP. And they both reached out to CurePSP within a couple of months of one another, sharing that they wanted to get more involved in the cause somehow. And I just knew right away that I needed to connect both of them with one another. It's been really an honor to work with both of them so closely through our growing advocacy efforts, and honestly to be witness to their bond with one another as they've navigated life as adult children of someone with CBD. So Julie and Salin, thank you for being here to share your insights with our community. I'd love to start by you introducing yourselves, including briefly telling us about your professional experience in public policy and your personal connection to CurePSP, and maybe a bit more about your pathway into getting involved in these efforts. And Salin, I'll start with you.
Jessica and Julie, it's great to actually be with you all. For all of you who are viewing, the bonds that get created through this disease are tremendous, and have really benefited from Jessica's guidance and wisdom, her compassion, and Julie the same, if not even more so, as we've accompanied each other through this. Salin Geevarghese, President and CEO of SDG Insight and a Senior Fellow at the Center for the Study of Social Policy. I'm hailing from the DC region, and I'm actually in DC right now. I do have and did serve as a former senior appointed leader in the Obama administration, helping on a range of place-based policy and investment priorities and the innovation agenda there. Have worked professionally on the issues of equity, inclusion, justice, and opportunity across sectors and silos for decades now, and have a keen interest in systems and policy change, which bring me to this conversation in addition to the personal. Jessica mentioned this. It's my mother, Grace Geevarghese, who was diagnosed with corticobasal degeneration. And it was our neurologist at Johns Hopkins University, also a member of this CurePSP family, Dr. Alexander Pansuyat, who connected us to CurePSP in short order. And if I'm remembering correctly, it may have been within the first visit where we were trying to figure out who else has this, who can we learn from, how do we actually manage this together. My family, and as Jessica mentioned, including my son, Sanjay, are all now engaged. It's now a family of folks who are engaged with CurePSP, and we're incredibly grateful. It's wonderful to be with you. Thanks, Jessica.
Thanks, Salin. And I'll just add really quickly too, I said I was looking at my notes from the last webinar. Our webinar early this year, the Community Conversations one, I actually interviewed Sanjay and Emma about their involvement in with us, especially as grandchildren of people with these diagnoses, and they started a meetup group for other grandchildren. So that's also, for the viewers out there, I encourage you to take a look at that webinar as well. But Julie, tell us a little bit more about yourself.
Yeah, absolutely. Thanks, Jessica. Hi, everybody. My name is Julie Balasalle. I am a social worker by training. So I have my MSW degree and have been involved in legislative advocacy pretty much since I graduated with my MSW in 2009. And I am originally from Boston and am now living in Canada. So I have sort of an interesting perspective on the differences in legislative processes in both countries. But my background is really, my professional background has really been in legislative advocacy on the state level, with some advocacy on the federal level. But as a social worker, I've done a lot of advocacy around mental health access in Massachusetts in particular, but also in provincial politics in Canada. So my sort of pathway to finding CurePSP was really focused around what can I do to help my mom. As Jessica mentioned, my mom was given a probable diagnosis of corticobasal degeneration in March of 2022. And she passed away this past January 30th, a few months ago. And I'm not a nurse, I'm not a doctor, I am not in any way, someone who could help with the, sort of process of trying to find a cure. But I am a lobbyist and I am an advocate. So that was what skills I thought I could offer CurePSP to help. So I reached out to see if there was any sort of advocacy movement that CurePSP was interested in, and it was just really great timing to meet Jessica and have her connect me to Salin, and just have some really great conversations about creating this advocacy arm within CurePSP and what we could do to empower the CurePSP community and really create more of a connection and awareness. So that was sort of my foray into CurePSP world.
Thank you so much, both of you, for being here today and sharing this. And that sort of leads me to my first question for both of you. We've mentioned a couple times now that this is new for us at CurePSP, and honestly, the three of us connected in sort of a serendipitous-ish time, because we knew for a long time that this is something that we wanted at an organizational level to get more involved in, and didn't have, I'm a social worker as well, but I come from the clinical world and I don't pretend to have this expertise and to have two people to approach us to say, we have that and we want to guide you and lead you in that. And I mean, it's made a world of difference, and we're so excited to share with everyone today what we've created so far and where we're going with that. And by the way, a term I learned from Salin here is fortunate of unfortunates, of how the three of us came together to make all this happen. But what I want to ask is, as we all know, our community members advocate every day in their journeys with these diagnoses. and are true experts in their diagnosis, expressing their needs around their care within the healthcare system and in other spaces. But advocacy at the legislative level is, like we said, new for us, but it's probably also new for many of our community members at CurePSP. We've made a lot of steps, or taken a lot of steps so far. So this past summer 2022, CurePSP joined the Unified Parkinson's Advocacy Council, or UPAC, which is led by the Michael J. Fox Foundation. This past late January, late February. Anyway, a couple months ago, Julie and I attended Rare Disease Week on Capitol Hill. We're in the middle right now with these two of developing a full public policy agenda at CurePSP. And we just launched this new toolkit that we're going to delve into more. And going forward, we're going to be asking our community to reach out to policymakers with different asks. These are huge milestones, as well as just necessary steps for raising awareness and improving care and finding a cure for PSP, CBD, and MSA. So we're early on in this journey. We invite everyone to learn with us. And I just share all of that as context for my question to Julie and Salin, recognizing your unique intersections of your professional and personal lives around this. I'm curious, what does advocacy mean to you? And how would you encourage our community members to get involved in this new way? Julie, maybe I'll start with you.
That's a great question. I think the term advocacy has lots of different interpretations, and I think as caregivers and as patients, there's a lot of advocacy that goes on that's probably at this point second nature, that people don't even realize that they're advocating for themselves or for their loved ones. And to sort of transition that into what is legislative advocacy, which is the advocacy that world that I work in, is really about the same kind of mechanisms that you use to advocate with a care team or an assisted living facility or a doctor or whatever it may be, whatever sort of advocacy that you do on behalf of yourself or your loved ones. It's just sort of in a different context. So for me, advocacy is really about raising awareness, and adamant awareness, so that it's not just, sort of a superficial, sort of raising of a profile, but really a longstanding, sustainable, adamant awareness, so that there's some sort of change that you're seeking, whether it's like a change in medication or a change in staffing at an assisted living facility. You stay on that. You stay on that really closely, right, when you're advocating for yourself or for someone else. And the same is true with legislative advocacy. We're seeking a change in legislation and we stay on it, and we talk to whoever we need to talk to, and we sort of continue through the process. And it's really important to sort of see those connections between the advocacy that you do every single day as a patient or as a caregiver, as someone who is impacted by this disease, or these diseases, and basically, sort of doing it in a different context with legislators and policymakers. So I think the really sort of underlying message is that a lot of people already do a lot of the things that we're going to be asking for. It's just in a little bit of a different venue, and really important that we empower our community to be able to feel like they are the experts. Because I will tell you that policymakers and legislators have thousands of asks in front of them. There's thousands of bills filed every single session, and they are not experts, and their staff are not experts on all of them, probably very few of them. And they need people like you to talk to them about why they should care, and to continually talk to them about why they should care and push an issue forward. So for me, the advocacy is the really important part is the sustained advocacy, that it's not just a one-time deal. It is a process that keeps going.
Salin, your thoughts?
Yeah. Jessica, Julie, and I have had this conversation. I'm going to approach it from an angle of not only as someone who is a lawyer and been a policy professional for a long period of time, but what it felt like to be someone who was the target of advocacy, someone who was lobbied, someone who, not from an elected standpoint, but from a kind of an appointed federal official standpoint. So the thing that strikes me, and I'll start this personally, is that what always struck me as someone who was on the receiving end of a pitch or a lobbying effort is the individual circumstances and stories that gave people an opportunity to kind of connect and partner with others facing similar situations. You know, the fact that people have signed on to this webinar is an indication that we share something in common. Our stories are going to be probably idiosyncratic. They have a lot of patterns to them, but there's an underlying commonality that gives us a lot of power and leverage. And in my own story with my mom who has CBD, we were faced with, you know, as often we do, few options to help her get better in terms of pressing for cure and just managing the disease. So much for us was managing into the unknown. And as I was engaging with my mom and our rest of our family, we faced this challenge initially, even with our story of, do we stay anonymous? Or at what particular point will we be comfortable sharing our story with others, quite frankly, even outside of our family? And that was a journey. And it is still a journey as her condition progresses. But for all of us who are accompanying loved ones in this disease, one of the things that definitely happened for my mom, I know it happened for Julie's mom, is for those of us who are care partners in this, we are giving voice to them that they themselves don't really have. And for my mom, it was a conversation with her that ultimately ended up being, what are your legacy making moments? That I would say to her, where is it that you could make a difference that hopefully might result in your situation getting better, but if not for you, perhaps for something beyond you, something larger than you. She was a retired teacher, and so for her to switch the instinct as a mother, number one, and then as a retired teacher to think about others was much more automatic. And the collective kind of service orientation switched our ability to say, what can we do now, even as we're going through this? How can we use our voice? How can we use our story? So from a personal standpoint, that was part of the journey, is realizing our story, leveraging our story, connecting it with other folks' story. As a former policymaker, honestly, I grew to understand the power of stories that are rooted in the case that you're trying to make. And I say story because beyond the level of expertise and evidence and information that all of us are always seeking in this disease, what you actually have is your story. And it is something that you possess and that can be leveraged. And so I speak often about a focus around that story. And so what happened for me as a policymaker was that people would end up coming, making the case. Often, sometimes I would have folks armed with evidence and data that led us to try to make rational decisions in terms of program design and policy making. And I think for those of us who've been in the policy realm, and Julie and I have talked about that, you can sometimes take the passion out of this, the emotion out of it, lead with the evidence and data. And I think that's appropriate in certain circumstances. I know in this circumstance, I'm armed with so much emotion, so much story, also linked with evidence and data, which I think on the receiving end becomes quite powerful when you actually get that magic coming together. So I think, you know, as I bring ourselves to this particular conversation and my own comments to a close, I really learned, and we'll return to this, I know, Jessica, the power of organized story, organized voice coming together, even in the midst of those commonalities and the similarities that we actually have, and just putting it to work. And I'll just say to Jessica's, and keeping up with it. It would be one thing if I heard it once. It would be a complete other thing if I heard it fairly regularly, and you would get a clear picture that people are behind you, and there's a lot of scale behind what the ask is.
Such good points. And along those lines, to turn it back to Julie for a second, in one of our conversations, the three of us, when we were prepping for this, you gave a really good analogy around pushing a boulder up a hill to sort of give you a picture of the collective organized voice. And I'd love if you could share that with our viewers.
Yeah, so I think it's the way to sort of think about it is the legislative process, just like, any sort of very complicated multi-step process is long. And there's lots of places where, and I'm going to talk about the actual legislative process federal legislative process in a minute, but the sort of process is really involved. And so it's sort of the way I think about it is sort of like pushing a boulder up a hill. And if you're doing it by yourself, it's going to take you a really long time, and the boulder might just come back and just completely flatten you. But if you have a sustained amount of people who are with you, who are pushing that boulder up the hill, and other people on the sidelines who are giving you tips or helping you, the more people you have pushing the boulder up the hill, the more likely it is that you're going to get up there. And that's a very simplistic way of talking about how legislative advocacy requires connection. It requires organized effort. It requires a way for people to, as Salin has said, collectively tell their stories. And this has been seen in lots of different movements. In the past, like 5 or 6 years, ALS has been really successful in gaining legislative traction because they have a very organized, concerted effort around telling their stories and being very vulnerable about what their experience has been with their disease. And I think there's a lot of connections that we can take from that and sort of see how we can, really focus the stories of those with MSA, CBD, and PSP to talk about it in a way that is really engaging. And I think that, sort of the other part of this is the connections that you need, like I talked about, of sort of pushing that boulder up the hill is partnerships. So we need to, have connections with other people. And as Jessica mentions, we have a very strong connection with the Michael J. Fox Foundation, who is also leading the charge on this bill. And what we can really offer in that partnership is the experience or experiences of those with these 3 atypical Parkinsonian diseases. And so we can really offer that as part of our relationship with them to sort of give that fuller picture about what the atypical Parkinsonian disease is like. And so I think that there's lessons in that, and sort of like, the more people we have pushing the boulder up the hill, the more likely it is that we'll get somewhere with it. We may not always get to the top, but maybe, we get a little bit further each time we try. And that's really the goal, is making progress. And making that progress together is really the only way. In a lot of, legislative movements, that has happened, that sort of collective effort. So as Jessica mentioned, we're early on in the days of CurePSP's foray into the legislative kind of advocacy world. CurePSP has been in the advocacy world forever. They have been a great partner for people who are advocating for themselves or for their loved ones. And we're sort of taking that energy and channeling it into this new arena. And I think that we are really poised to be able to make a significant difference. So I think that partnerships and empowerment piece is really important, and something that everyone who's involved with CurePSP, regardless of how much time you have, are able to really contribute to if it really speaks to you.
Yeah. I think this is such a great conversation, because just tying those two together, of how a lot of people will share they feel really small when it's up against the political system. And, I can tell my one story, but how much of a difference is that really going to make? But then when you have many people telling those stories, it makes it that much more impactful. And it shows policymakers that even though they might not be personally touched by one of these diseases, that this can still be a personal issue, because, you know, here's this whole big resilient community who are all saying we need this thing together to improve all of our lives. So that one story can make that world of a difference in that bigger picture. And so, you know, we're talking about policy, we're talking about politics, and I think something that we've wondered if this is going to come up as we're growing these efforts is, understandably, some people might be kind of wary to get involved in legislative advocacy related to the current political climate. So maybe, Salin, I'll start with you. I'm hopeful that you can kind of define for people or clarify what is the difference we're talking about here when we talk about politics versus policy.
Yeah, I would tell you, and Julie will join me in this effort as well as we try to clarify it. People conflate the two. It's understandable that people would conflate the two, given the nature of the political environment and climate. Perhaps the last conversation that anyone wants to have, even in a compelling invitation that any of us would actually, is to engage in this advocacy process, if in fact it feels distasteful to you, given what you have seen. So I understand it. Julie and I both understand it. My argument to you, even as we think about definitions of politics, I think of politics as how we use our power to affect an end. And to something that Julie mentioned before, whether you've defined yourself in the case of your loved one with one of spectrum of disease of MSA, PSP, or CBD, you've had to advocate. You've had to use your power, right? And getting in touch with yourself as, quite frankly, a political person, small p political person, that actually can use your power toward a much larger end, I think is the way I would think about politics. So my argument is, I think we need to reclaim politics as something that we all can feel comfortable doing as we actually engage in the effort. Now, from a policy standpoint, I think of policy as addressing and influencing the actors, the conditions, the behaviors, the decisions, the systems at scale of a particular issue or concern. And so, you know, there's a distinction between the two, but if I can demystify it, or at least invite you to go on the journey with us, to say, use your power. You have it. We have to be increasingly comfortable with it. And actually, if anything, for the voiceless ones among us who are feeling powerless, we need to come into our power in that way. So politics often, I get it, often takes us to partisanship, to divisiveness. We have to reclaim our ability to act politically, to have an influence in the midst of everything that seems very crazy and divided now. And for us in the CurePSP community, I think we can think about engaging in policy advocacy is about trying to, you know, avoid as much as possible getting mired in the dirt and the miring of politics, while needing to engage as political actors, focusing on the policies that sit beneath, that are driving how our diseases are being addressed, making sure that we can actually stay focused, as Julie says, over the long term. And it's about maximizing the opportunity for change, sticking with the issues over the long term. So in that little definitional distinction I would draw, Jessica, I would say, yes, I get it when we think about politics in the stuff that we see on the news, the stuff that we want to stay as far away from. But I really would like to invite people to actually think about themselves as powerful people, as people who are willing to use their power for a larger end. And there's no larger end than for us to get engaged in the CurePSP fight.
Yeah, I love that idea of reclaiming ownership over that. That's really empowering for sure. And I guess along similar lines, sort of our other thought around a hesitation or frustration that we might hear from folks, or sort of have already heard from some folks when we have these conversations, is how slow and partisan the process of how a bill becomes a law, and like how policy works in the United States. And that I can see causing some people to say, like, you know, what's the point of me sending this one email to someone when there's like 20 other steps to get this bill passed, and it might not feel worth that effort. And so, Julie, with that in mind, like, what advice would you have for someone regarding that?
Absolutely. I mean, it's a really good point. And it's, I think there's also like this understanding, like Salin said, about like the current political climate, and sort of just throwing in the towel and saying, like, I don't want to deal with this. And then you layer on top of that sort of the legislative process itself is not a fast process for the most part. So how do you, or why should you stay engaged in it? And I think, you know, one of the lessons that I've learned in my experience is, you know, the fact is that nothing is going to change if you do nothing. Nothing will work unless you do, which is my Angelou quote. And I think it's sort of like recommitting to that notion that your time is worth putting into the possibility of change. And Salin has, I think, said this before. I don't know if it was on this, I don't think it was in this webinar, but basically that like there is a level of patience that these diseases require for the people living with them, as well as the people in their lives. And so, you know, sort of channeling that and having that understanding that, you know, the diseases will progress as they progress. And that, you know, you don't have any control over when or what will happen with these diseases for the most part. But you are going to be there, and you are going to, you know, be an advocate for yourself or your person. And that is sort of exactly what it's like to advocate in the legislative arena, is that I'm in it for the long haul. Like, this is too important to me to not do anything about. I have no control over the partisanship of our country. I have no control over the partisanship of our government systems as they stand. But I have the power of being able to use my voice to try and change some or inform some people and understand that it's a longer haul. The other thing is that, you know, these diseases don't care where you lie on the political spectrum, and they don't care, you know, anything about that. And so they're in itself, they are nonpartisan issues in, you know, just from the perspective, you know, of that they, you know, have impact people on both sides of the aisle. That said, you know, the sort of social determinants of health are real. And, you know, there's a lot of really interesting sort of connections, you know, made around the social determinants of health and sort of what that impact is on different communities, which I think we should and absolutely will, you know, sort of talk about with legislators. But the fact of the matter is sort of having that, you know, kind of perspective that, like, this disease doesn't care, you know, whether there's an R or a D next to your name. What it cares about is, you know, sort of the impact it will have on your life. And so that can be conveyed to anybody. And so I think that is what I try and hold on to in these really sort of difficult partisan times, is that I'm going to keep plugging away at this, sort of like, I'm going to keep pushing this boulder up the hill. And regardless of whether it's raining or sunny or whatever's happening, I am so committed to this as a part of my mom's legacy, and being able to talk about her experience because she isn't able to is more important to me. And so I just sort of focus on that rather than these other pieces. Not to say I don't get frustrated, or not to say that it's not, you know, incredibly disheartening at times. The flip side is that it can also be incredibly rewarding, and, you know, creating more of an awareness around policymakers and their staff is exactly what it's about. So this is the first step in sort of committing myself to do that. And I encourage people to think about it in that way as well.
Thank you. I mean, so well put. And so I think with that, I am being mindful of our time, because I would like to leave, if we can, like maybe 10 or so minutes to take questions from viewers as well. I'd love to move us into talking about a specific bill that we are advocating for at this time. This webinar and our growing efforts in this arena over the past year or so come at a particularly exciting time, because at the end of March, the National Plan to End Parkinson's Act was reintroduced to Congress. This bill is the first of its kind to address Parkinson's disease on a large scale through coordinating federal efforts. That's not to say that there haven't been efforts going on at the federal level around Parkinsonian diseases, but it's really a call for an advisory council and intentional coordination of those efforts. And what's really historic and meaningful for our community at CurePSP is that PSP, CBD, and MSA are specifically named in this bill. So even though it's called the National Plan to End Parkinson's Act, when we talk about Parkinson's in relation to the bill, it's covering all of them. So Julie, I know that you prepared a short PowerPoint about this, and if you could walk us through what the creators and the sponsors of the bill hope to accomplish for the Parkinsonian diseases, and how our community members can take action through our new toolkit at CurePSP, and sort of what's, future points in the process, that would be awesome.
Absolutely. So the National Plan to End Parkinson's Act, you may have heard us talk about this before. It was actually first introduced during the previous Congress, so last year, and it didn't progress. So once a bill doesn't progress and isn't passed, it has to start the process all over again. So the legislative process, the next session began early this spring, and this bill was filed on, I think, March 29th of 2023. So it's still very much in the early stages of the legislative process. So this is a bill that is, it's a bipartisan bill, which means that it has support from both major parties. The other really important piece is that it's a no-cost legislation. So it is not something that is requiring funding for any of the pieces within the bill. And what it really is it's following a blueprint that other groups have followed, in that it really is trying to create an investment within the federal government to, as Jessica said, coordinate efforts around the Parkinsonian diseases, including our 3 atypical Parkinsonian diseases, to create a national plan. So the Alzheimer's community also had a similar bill, or not a similar bill, but a similar strategy. And so the first part is to sort of create this council that will look at sort of what all of the federal components are, and engage with stakeholders, including the medical community, the caregiving community, and really try and sort of pinpoint what is needed to accelerate towards a cure, and also to improve quality of life. So it creates this advisory council that works on that, and it also has to prepare to Congress a report, so that it will give them an idea about what needs to happen and how much it will cost. So this is the first sort of main piece that this bill will introduce. It's important to note that it sort of lays the foundation, like I said, for Congress to address these issues found by the council, and sort of create and paves the way for further legislation to address it, whether it's through resources or through any sort of further legislative direction. So this is really, again, it's filed by, in the House, it's filed by Rep. Balasalle, who's actually the co-chair of the Rare Disease Caucus in the House. And on the Senate side, and he is a Republican from Florida, and on the Senate side, it was filed by Senator Shelley Moore Capito on the Senate side. So it's important to note and she's a Republican from West Virginia. And so I'm going to talk a little bit about sort of what we would love to have in terms of engagement from the CurePSP community on this. There's so many really exciting things that we have put together to sort of start talking about how to engage and advocate on the legislative level. So I'm just going to talk a little bit about the process to give you a sense. And this is, again, I know that this is a little bit, the writing is a little bit small on here, but this is also in our toolkit, which I'm going to be talking about in a little bit. But just to give you a sense of sort of what the bill has to go through in order to get passed. It's sort of, and this is just on one, if this is the House bill, it has to go through this. If it's a Senate bill, it has to go through this, and then you switch it into the other chamber. But just to give you a sense that every single one of these steps is a place to advocate. So whether it's sending an email or making a phone call, and I will share, I interned in Washington for a congressional office. And, if there was something that was really, if there was more than 4 or 5 calls on something, they would put a legislative staffer on it. That's different for every office. But just to say, if no one calls or emails about something, then nothing is really going to move, because like I said before, there's a gajillion different legislative priorities that are moving through the House and Senate at any one given time. And so if they're not prompted to really do something about it, chances are, this isn't like an absolute, but chances are that nothing's really going to move, or they're not going to feel invested in it if the people in their community tell them that they don't really, by not telling them, that means that they're not really going to be invested in doing anything about it. So it may seem repetitive. You're like, I've already emailed my legislator about this. I don't know why you want me to do it again. It's because at each one of these points, if the bill doesn't get enough progress, then it just sort of dies and it flounders, and we start the process all over again if it doesn't pass. That said, it's super common for a bill to not pass and then get refiled again. And sometimes it can take 3 or 4 tries to get something passed. But it's through that concerted effort each time and thinking about how many people you're letting know that this is important to you, that anything is going to happen. So I'm not going to go through each step, but I just wanted to give you a visual of what it's like to actually go through this process, and why we'll say hey, we know you just emailed your elected officials, last week about this, but right now it's on the House floor and we really need you to let them know. Because it's really a quick and easy way for them to know that people care enough about it that they are sustained in keeping their advocacy going. So that's sort of a quicker way of talking about that process. And on the CurePSP website, we've just developed, as Jessica's talked about, a toolkit that is specifically around the National Plan to End Parkinson's Disease. And so the National Plan to End Parkinson's Act, sorry. And so if you go to the I Want to Help portion of the website and you scroll down, it will say Become an Advocate. And this is where you'll find the letter that's pre-populated that you can just put in your voting address into, and it will send it right away once you press send to your elected officials, your specific elected officials. A note that it should be a voting address and not a commercial address. But just wanted to give you this visual so you can know that you scroll down on the website for that. And then the other pieces that we have in the website are something that we call a one-pager or a fact sheet. And it's a really concise description with the bill number that talks about the bill and what it will do. And it's something that we usually give to legislators or their staff when we meet with them to talk about a certain piece of legislation. So we've created that. We also have, like I said, that pre-written letter. And I encourage you all, as to Salin's point about stories, the letters can be edited, so you can add, what your personal connection is, and why it's important to you as their constituent. And again, it's really dependent on each office. But the more comfortable you get telling your story, I think the easier it is. So I encourage you to share what your connection is specifically to these 3 diseases. We also have a call script for people who would rather call their elected officials to talk about this. People ask, is one better than the other? And it's really, I think it's sort of a draw. I think whatever you actually is going to do is what is best. So if you are like hate the phone and don't want to use the phone, then don't use the phone. But if you feel more comfortable talking, that's fine. We also have like an FAQ about the bill, some questions that we've gotten around the specifics of the bill. And then that slide that I showed you with the outlining of how a bill becomes a law, very similar to the Not As Fun as a Schoolhouse Rock video that maybe you all have mentioned, have seen, about how a bill becomes a law, but just something to sort of refer back to see where it is in the process. So that's sort of our quick introduction of the toolkit. And I just, again, wanted to stress sort of, when you do share your story, it's important is, again, share your specific connection to the atypical Parkinsonian diseases. In the large scope of advocacy for this bill, there's a large presence around Parkinson's disease. And so we really want to highlight, the experiences of those with atypical Parkinsonian diseases. As we all know, they're really rare and a lot less well known. So the more we can sort of talk about them with legislators and policymakers, the better. And specifically how it's impacted you, your family, your community, whatever it may be, because it's what we're trying to do is show how the impact impacts people, how the impact of these diseases is felt. Because what we want to show them is basically, how would passing this bill change your experience? What is the cost of not passing it? So if we did nothing and we didn't advocate at all and we didn't pass this bill, what is the cost of not passing it? And so that's sort of like, basically is like, why should they care? And there's lots of different reasons for it. And I think that you could, to Salin's point, you could talk about the data, and you could talk about how, there's billions of dollars in healthcare dollars every year that go towards the Parkinsonian diseases. But for you personally, I know, like, specifically, for my family, how devastating it was for us to know that there was no cure, there was no treatment for CBD, there was very, very, very little that we could do to help my mom. And the hope of having something that maybe at some point would have made her experience better, that would have been tremendous to our family. So, I think that something like that would be a good way of thinking about, sort of what would, if this bill passed, how would that change your life?
Julie, I'm so sorry to interrupt, but can I ask a super quick question? And again, being mindful of our time, how long would you advise someone to keep their story? I mean, one of these stories around living with this diagnosis can be so long because people live with it for years and there's so much that goes into it. So it's hard, I imagine, to boil that down to a brief and effective story in this kind of way. So what advice would you give around that? I would say, like, a few paragraphs if you're writing, like, not like an opus. Like, we definitely need to have, because I guarantee there's going to be someone reading your email who's going to be interested, but they also have, hopefully a lot of other emails to read and to tally. So I'd say, to sort of hit on the milestones of the disease. Particularly, I think it's really important to let them know how long it took you to get a diagnosis, because that is, I think, something that's very telling for our three diseases. And then for when you're speaking, usually when we meet with offices, we usually, I think, would say between 3 to 4 minutes per person, because again, there's a lot going on and there's, probably more than one person telling their story. But especially when you call on the phone, you're going to get like an intern at the desk, and they are wonderful and awesome. But again, it's sort of like they are more interested in sort of what specific bill. So have the bill number ready, and let them know who the sponsor is, because they'll need that information to let them know that you want them to co-sponsor the bill. So that's the ask that we have right now. So I'd say individually 3 to 4 minutes tops if you're meeting with an elected official in person or via Zoom or something like that. But again, sort of really trying to distill your experience, which I know is really difficult, into sort of those milestones to really express and demonstrate, what this experience was like
or is like for you and your family.
Perfect. Thank you. Is there anything else that you wanted to cover here about the bill or the toolkit?
So basically what I said was there's a lot of places where we'll be asking for your help, like I said earlier. And every step in that chart of what the bill process is like is a place to take action. So for some people who are super busy, sending an email, if you don't want to edit it and you just want to send it, it takes 2, maybe tops 10 seconds to just send an email without editing it. We're hopefully going to be having virtual meetings with members of Congress. So, being able to attend those would be really fantastic. The other thing is just forwarding the emails that you get from CurePSP to your friends and family, asking them to send letters. It really matters to sort of see the scope of this and how many people are hearing about it. And then if definitely, this is just me personally, I think it's really important to talk with, if your support groups with CurePSP or other networks, or even your care team, I would definitely let your doctors know about this. They may or may not know about it already, but I think there's definitely an important way to sort of also get a different perspective for the healthcare community to become involved. So there's lots of different ways, and this is not an exhaustive list, and we will be sharing more ways to get involved. It's really about what is your capacity in a realistic sense, if you're a caregiver, or if you have a million other things going on. We have a smaller investment in time versus longer ones too. So we will take whatever you have to give, and we are so appreciative of all of your time and energy, because we wouldn't be able to do this without you. So we just so appreciate it. And that's all my slideshow. So I'm good.
No, it's such a great overview of it. Thank you. Thank you. And now I'd love to move us into questions from our viewers. And this also is from people who had registered before. But first, I want to point out that one person shared in the comments, we need a concerted effort from CurePSP and its members to advocate in the political arena to inundate legislators with the urgent need for passing the National Plan to End Parkinson's Act. So
totally agree, Alice.
Exactly.
100%.
I'm loving the energy
Thank
there.
You.
This person is raring to go. I think it might have been the same person actually that asked a question, and I'll ask it to you, Julie, since you're talking about the bill. Will you be letting us know which stage the bill is in the process to the CurePSP community?
Absolutely. So it's my hope that we'll use them as rallying points for action alerts. So letting you know that it's now gone to a different committee or it's on the floor. Those are all places to have actions taken. So Alice, it's my hope that we'll be able to send those out, within a reasonable time frame. But it is definitely something that I think is a priority for CurePSP, if I can say that, Jessica, to really involve the community as much as we can and have some real-time actions taken.
Yes. Okay. Looking at questions. And we actually sort of responded to this, but I love your additional take. And maybe, Salin, let me ask you this as someone who had been pitched to. Someone asked, what is more effective when contacting a member of the Senate or the House, writing or calling? And then, of course, we also know there's, meeting with them too. Is there a particularly effective?
Yeah, it's a great question, Lee. I appreciate you actually asking it. You heard Julie also mention the notion of landing on where you're most comfortable. I will tell you again, as someone who is on the receiving end of this, and under some level of obligation to make sure that you're taking a look at things that are coming in. So, there's infrastructure that gets created that has to respond, at least try to figure out a way to respond to the inundation, right? And so into my office, when we got letters all the while, we had staff members who tried to keep on top of it, glean what was coming out of it, figure out exactly what we need to take action on. So correspondence, obviously, in whatever forms, still is really, really helpful. The fact that CurePSP and the team is actually putting together notions of what a stock email or a stock letter actually might look like, and those that could be customized or personalized. You can always get a feel of folks who are joining an effort and wanting to be a part of an effort to actually move something forward. So I would say, Lee, whatever is comfortable. I would also say, and I got visits as well, and I got visits by groups. And so it was one thing to have an elected official or a member of a community actually come, but when someone called my office and said, there's a group of 20 people actually who are already on your schedule and scheduled to actually meet with you, and they need 10, 20 minutes of your time, guaranteed we had to, if they showed up, we had to figure out a way to actually accommodate them. And so that, again, may be an additional step, is not only thinking about correspondence or a call, is where and at what time might we get more organized to have physical presence, and so that the people are there in front of you. And that was, again, always effective. I always had what Julie mentioned before, the one-pagers, the quick snapshots, the stories. People would go around a room and actually share them. So, there are multimedia, multi-way in which to think about this. And Lee, to your ultimate question, it's where you can feel most comfortable. And the truth is, last point that I'd make here is, you probably start a certain way and you gain more comfort in exploring other areas, right? Everyone starts a certain way, and then it starts as an email, it extends to a phone call, it extends to maybe a visit later on down the line. And so the question probably is, what's the best way for you to start?
Yeah. Yep, great points. And we had received a number of comments from people who were registered for this, who basically were asking, like, I want to get involved, but don't know where to start. And so just picking one of these ways that you're most comfortable with as a foot in the door, and then feeling it out, learning about it, and then that could branch out into other ways to get involved down the road. Somebody asked,
Jessica,
and I don't know. Yeah, go ahead.
Can I mention one other thing that occurred to me, perhaps as an incentive to something that Julie put on the table earlier in her presentation, which is, it is from a political climate perspective, it can feel like a very noisy time. And in the midst of the noise, any and all of us could make a decision like, I don't want to add to the noise, right? I assure you, vacuum does not stay vacuum. It just gets filled with other messages and other voices. And so for us, actually, as a community, to actually be more present, it's going to be comfortable, not adding noise, but adding our voice in. And we have to figure out a way to do it, because I assure you, in my own experience, when I didn't hear from someone, I definitely heard from other people potentially taking other positions. And the louder those voices got, sometimes I would end up asking, like, what is the other side of this? And where are they, right? Where is their voice? So that's the other thing that I wanted to mention, is like, it's not as though no one will say anything. Plenty of things get said. It's a matter of whether our voice will have the volume necessary.
Julie, do you want to add to that at all, or any
I was just going to say that I think it can be intimidating to have these conversations, but this is their whole job. Like this is like their whole purpose in being an elected official. And if you don't meet with the elected official, but you meet with their staff, sometimes that's even better, because the staff are the ones who like actually do things in the office. So I wouldn't feel like you're being, like not taken seriously. That's sort of, again, like the whole staff person's job, and can be to focus on specific issue areas within, like I said, there's so many issues that Congress is contemplating at any one given time, that usually there's a staff member on healthcare, and that's the person that you might meet with. And it's not in any way like a slight towards you. It's more just like the way that they can use the resources that they have. And also, the importance of, as Salin was saying, sort of, the cost of not saying anything, and what that means for sort of any sort of progress not being made, I think is an important note, because I think it's something that if you decide to not engage, somebody else is going to engage and someone else is going to take that, whether it's, I don't think that there's a lot of opposition to this bill, but just sort of like in general, that sort of, again, adding to the noise is not really the way I think about it. I think about it as adding a really important voice that isn't there. And so that's what I think is the most important. So I think, to Lee's question too, what is most, what is most effective? I also think it's important to think about the partnerships of building a partnership with your legislator's office. Like there's, there might be legislators who you, know personally or know someone in their office, but also like, it's fine to be that person who's like, hey, that, person who's really invested in the National Plan on Parkinson's is on the phone again. And that's fine. Like, don't worry about being a bother. Because again, it is a function of their job is to be there for these pieces of advocacy. So I think sort of having that connection is really strong, because you want to create those relationships and build those partnerships with those members and their staff, because there might be other bills down the line that you want them to, some of these other public policy initiatives that we're working on in CurePSP. And so if you already know who to talk to, you can have that direct line. So sort of building those relationships, I think, can be really fruitful and rewarding for you as well.
Yeah. So two thoughts with that. One is this whole area is completely new to me as well. And it was like drinking from a fire hose the week, Julie, you and I went to Rare Disease Week on Capitol Hill, which was organized by a different organization. And when I went around with my group for the North Carolina jurisdictions of, meeting with the staffers, these people that I was working with or in my group with, they've all been doing advocacy work for years. They were all touched by different rare diseases. And I could tell who they had these relationships with. And you could tell that those staffers that knew them were more engaged in that conversation. Like there was one particular where my group was like, hey, Gary, his name was Gary or Garrett, it's so nice to see you again. Remember us? We're the rare disease folks. And he was like, oh yeah, how are you doing? How's your son? So, because that relationship, that rapport is there, you're more likely to probably be heard. And I'm also hearing from what you two are sharing that, the status quo isn't going to change, right? And maybe it won't change if we speak up, and that's frustrating. And I get that, but it's definitely not going to change if we don't do anything about it. So it's about creating a seat at the table for ourselves and carving out that space, because probably no one's going to be like, hey, would you like to have a seat at this table with us? We're saying we need to be heard. So I know that we're 5 minutes over, and this happens sometimes with our webinars. We'll probably go just a few more minutes over. If people need to hop off, that's fine. Again, this will be recorded, but I would like to get to 2 more questions. Salin and Julie, quick check-in. Is that okay with you and your timing? Yeah? Okay. So one question one of our viewers asked live here, and I don't have the answer to this, but I'm sure we can look into it. I don't know if either of you know, do we have data to compare how much federal funding goes to ALS versus to PSP, CBD, and MSA? And it's an interesting point, because I know you brought up sort of how ALS has approached this, and we're, Parkinson's is sort of following a similar approach or structure. And the number of people, interestingly, living with PSP, CBD, and MSA is pretty comparable to people living with ALS in the United States. Do you all know the answer to that?
So I don't know the specific answer. I know Biden just signed a bill, I think it was in the past year or so, around ALS research. And I think the other thing that's a little bit more murky around our diseases is that, if they fall under the umbrella of Parkinson's disease, does Parkinson's research dollars, sort of fall in line with, is that considered, the atypical diseases, or is that considered in there as well? Because, this isn't the first bill that's specific towards to Parkinson's necessarily, but the answer is, I don't know the answer is what my answer is, but also I think it's a little bit more because they're 3 separate diseases, but also fall under the umbrella, I think it's a little bit less clear about what we or what is considered funding for the diseases. But in terms of like awareness, like not necessarily financial resources, but I think that ALS has a lot more awareness just in general in society, but specifically within Congress. I think there's a lot more awareness around ALS because of the sort of concerted, sort of grassroots movement and the Ice Bucket Challenge and things like that. So, there's, I think, definitely, an avenue for us to pursue and sort of thinking about is, sort of what is comparable to some other diseases around that are at the same level of rarity. But yeah, I think it's a great question, and I don't have an answer to it, but just wanted to sort of add that other context that there's some, it's not really, we can't really make it apples to oranges because we have three of the diseases that are separate, but also under this umbrella of Parkinson's. So it's a little bit more murky, but point well taken, and one that I think we can definitely look into.
Yeah, the only other thing that I would add is, and this gets to something that all of us actually mentioned at the beginning, is, and I can imagine for any of the folks who were listening in, thinking about the visibility of these diseases. I know for our family, I suspect for many families who are listening and watching this, is in addition to the voicelessness, people don't have a picture of these diseases. And this gets to the notion of story, this gets to the notion of who represents this disease, who's willing to be more public about it. With ALS, we have this iconic person that everyone associates with, right? There are people that CurePSP knows of some public visibility who I know for themselves are still perhaps deciding, do I want other people to know? And I shared with all of you that same, not with any public visibility for our family, but that same conversation for my mom was, are you willing to be vulnerable with your story for the sake of a larger end? And I think all of us are going to have to probably figure that out because, I think we're going to need it. I think we're going to need more pictures, more icons, more opportunity for people to get a day in the life of what it means to have this disease, so they really see it more clearly.
And also, too, I think Lee just asked about Brian Wallach, and Brian's a great example. I mean, he was also a senior official within the Obama administration, so he was pretty connected already, and I think that was a really, he had a lot of that knowledge and has done a lot of work. The IMLAS organization has done incredible work around raising awareness and specifically legislative advocacy work. So I think that is a great example, Lee, that organization has done incredible stuff. And I think Brian's sort of knowledge of that was really helpful. And I think that's, another layer to it too, is, how do we leverage the knowledge that we have, and I don't just mean Salin and I, but just sort of as a collective, and be able to really make some of the really great suggestions that you have, sort of like with Alice's around media and, sort of telling our stories in a way that's really impactful, is again useful. I think just raising awareness in general, but in terms of legislative advocacy, absolutely crucial.
Yeah. And it's something that we need to, when we talk about awareness and advocacy, we have to approach it at each level and from multiple angles. And that's something that we're very much aware of and having many conversations around here. And we want to do all of them strategically and do them well. And especially the media coverage thing is something that Salin and I have been talking about how to approach that. And there are some things in the works. So we are 12 minutes over at this point. I know there's a couple other questions we didn't get to that we I'm seeing in the comments here that we got through registration as well. And I have made notes of them, so maybe we could follow up with some folks individually. But also, I encourage you, if we didn't get to your question today, or you think of something afterwards, please email us at, our general email is info@curepsp.org, and we will do our best to answer your question or get you to the right resource from there. So with that, I want to move us into closing. So one more thing that I want to add with all of this too, just to really emphasize this or underline it, I don't know, this is the first of many conversations. So we're just delving into this. We're going to be rolling out other resources. I would like to have future webinars on this topic, sort of check in on different bills and other points around legislative advocacy. We need to talk about what this means at the state level. There's lots more we could talk about.
And in Canada, somebody.
And yeah, I saw that too. I'd love to talk about this.
I'm with you, Lynn.
Yes. So we will get there. So much more to come. A big step for us at this point, and Julie and Salin are part of it, is we are coming up with a full public policy agenda and priorities. And part of that is vetting and tracking other pieces of legislation that might not name, it's going to be very rare that they ever name our diseases, but we want them to be relevant for improving the lives, the care, the cure of these diseases. And we'll be asking people to be engaged and advocate around for those, at different points. So stay tuned for all of that. I hope that all of our viewers enjoyed this very informative and dynamic conversation as much as I did, and that you're all leaving feeling empowered and ready to take action at this new level for the PSP, CBD, and MSA community. And Julie and Salin, I'm so grateful for you sharing your time and your expertise with us. It's just always a pleasure to talk to you as well. Like I said, please email us, anybody, at info@curepsp.org with other questions. I do have a couple of very quick announcements before I let everybody go. It is CurePSP Month of Awareness. It's really a great opportunity to intentionally get involved with our cause in whatever way you're comfortable with. And we've created a toolkit for that, from sharing your story on social media to starting a fundraiser to the legislative advocacy toolkit. You can find that toolkit on our website, www.psp.org. Our next webinar will be an Ask the Expert on the topic of the what, the why, and the management of urinary symptoms for PSP, CBD, and MSA on June 20th. Also, please save the dates for our next family conference. It will be in person in Orlando, Florida on September 20th and 21st. And that will be in partnership with our 2 CurePSP centers of care in Florida. It would be great to see you there. And the full agenda and registration page will be up on our website really soon. Information on our upcoming events can be found by scrolling down to the calendar on our website, or going to curepsp.org/calendar. Getting on our email listserv and following us on social media are also great ways to stay up to date on our programs. As I mentioned, today's webinar will be archived on our CurePSP TV YouTube channel and on Facebook, and we encourage you to check out our YouTube channel to view past webinars and other educational content as well. And lastly, as always, we're able to offer these webinars and all of our programs and resources because of generous donations. So we really appreciate your support of CurePSP's mission to raise awareness, build community, improve care, and find a cure for PSP, CBD, and MSA. Julie and Salin, thank you again, and please take care, and everyone enjoy the rest of your day.